cytomegalovirus, a common yet often overlooked virus, or CMV, a virus most people have never heard of despite its prevalence. But it is one that poses a real, significant risk during pregnancy, a time when extra precautions are paramount. For healthy adults, CMV is usually harmless. Most won't even know they have it. Maybe a mild cold, maybe nothing at all. It often goes unnoticed, lurking silently. But during pregnancy, this virus can cross from mother to baby, which is where the concern arises. This process is called congenital transmission, and it's the primary way CMV affects newborns, and it can cause serious lifelong health problems for the child, impacting their quality of life. CMV is actually the most common infectious cause of birth defects in the United States, a statistic that's quite alarming. In fact, it's more common than Down syndrome or fetal alcohol syndrome, conditions that receive significantly more attention. Yet awareness is low, and that needs to change. We need to bring CMV into the light. Today, I'll break down what CMV is, explaining its structure and how it operates. I'll show you how it sneaks past the body's defenses, evading our natural immune responses, and what that means for a developing baby, highlighting the potential impact on their growth and health. We'll explore the placenta, not just as a source of nutrients, but as a critical interface. We'll see it as a security system for your baby, a vital barrier protecting them from harm. And we'll see how CMV manages to bypass this system, finding its way through this protective shield. This isn't about fear, it's about knowledge and empowerment, giving you the tools to make informed decisions. By the end, you'll know the real risks associated with CMV during pregnancy, and most importantly, the practical steps you can take to protect your pregnancy and your baby's future health. Let's get started by understanding the incredible structure meant to protect your baby, the placental barrier, a complex and fascinating piece of biological engineering. This biological fortress is designed to keep harmful things out, acting as a selective filter. But even the best defenses have vulnerabilities, and CMV is adept at exploiting them. By learning about CMV, you're taking the first step to a healthier pregnancy and a brighter future for your child. Let's dive in and uncover the secrets of CMV and how to protect your little one. To understand how CMV gets through, we first need to understand the amazing system it has to bypass. We need to appreciate the placenta, your baby's first bodyguard, and a truly remarkable organ. It's a temporary organ that develops during pregnancy, providing a critical link between mother and child. The placenta is your baby's lifeline, the source of everything the baby needs to grow and thrive. It's responsible for delivering oxygen and vital nutrients and efficiently removing waste products from the baby's system. But beyond its role as a supplier and remover, it's also a sophisticated security checkpoint, acting as a barrier against harmful substances. This security system is known as the placental barrier. This isn't a single wall, a simple blockade, but a multi-layered filter, a complex and dynamic interface. It's made of specialized cells called trophoblasts, which form the outer layer of the placenta. These cells are highly selective, carefully controlling what passes through. They are designed to allow essential nutrients and oxygen through, ensuring the baby gets everything it needs. At the same time, they're designed to block most bacteria, harmful toxins, and dangerous viruses. That's why most common infections don't reach the baby thanks to this protective barrier. Think of it as an advanced security system, a highly sophisticated and finely tuned mechanism. Nutrients get a pass, welcomed through the gates, intruders are stopped, denied entry to the protected space, but like any security system, it's not foolproof. There are vulnerabilities and weaknesses. Some pathogens like CMV, the cytomegalovirus, have evolved ways to slip past the guards, finding loopholes in the system. They can disguise themselves, mimicking harmless substances to gain entry, or find hidden passages exploiting alternative routes to bypass the main checkpoints. This is where CMV's story begins, the story of a stealthy invader. It's a virus that's figured out how to breach this incredible defense, posing a risk to the developing baby. Understanding the strength and complexity of the placental barrier helps us appreciate just how cunning and adaptable CMV must be to overcome it and potentially cause harm. Let's look at how it compares to other potential threats during pregnancy. To put it into perspective, next up, the notorious torch infections, a group of infections known to cause problems during pregnancy. CMV, or cytomegalovirus, is part of a group of infections doctors call torch, a collection of diseases that can pose significant risks during pregnancy. Toxoplasmosis, other agents which include a variety of bacterial and parasitic infections, rubella, also known as German measles, cytomegalovirus, and herpes simplex. These are the key players in the torch complex. These infections all share one critical characteristic. They can cross the placental barrier, the protective interface between mother and child. This crossing can lead to congenital infections in the developing fetus. Congenital infections, unfortunately, can sometimes result in serious birth defects, impacting the baby's health and well-being, and a range of developmental problems that can affect the child throughout their life. To mitigate these risks, doctors use torch screening, a series of tests to check for antibodies to these infections in pregnant women, indicating past or present infection. The risk to the baby is generally highest if the mother gets a primary infection, her first time encountering the pathogen, during pregnancy. CMV is the most common of these infections, and unlike rubella, for which there's a highly effective vaccine, there's currently no vaccine available for CMV. That makes prevention through hygiene practices and public awareness campaigns even more important. While other torch infections are relatively rare in developed countries, CMV is widespread. Many pregnant women will be exposed to it during their childbearing years. These pathogens have all evolved sophisticated mechanisms to exploit the unique immunological environment of pregnancy, effectively turning a lifeline, the placenta, into a potential route for infection. By studying torch infections, scientists gain valuable insights into how the placental barrier functions, and crucially, how it can be breached by these opportunistic pathogens. This knowledge is absolutely key to developing new and improved strategies for prevention and treatment. And, hopefully, one day, a future vaccine for CMV. Now let's delve deeper and see how CMV actually manages to sneak past the placental guards. Here's a closer look at how this cellular heist actually happens. So, how does CMV get through the placental barrier? It starts when a pregnant woman is infected either for the first time or through reactivation. The virus enters her bloodstream, reaching the placenta. CMV targets the placental cells, trophoblasts, using special proteins to unlock entry. Once inside, it hijacks the cell's machinery to make more viruses. Instead of spreading openly, CMV moves stealthily from cell to cell, avoiding immune detection. It's like a spy slipping through secret passages, getting deeper into the placenta. CMV is also a master of disguise, hiding from the immune system by preventing distress signals from being displayed. This stealthy approach lets it cross into the fetal circulation, reaching the developing baby. Infecting the guards, moving in secret, and wearing an invisibility cloak, this is how CMV completes its journey. But the placenta is more than just a single barrier. Let's zoom in on the journey. The placenta is a complex multi-layered tissue CMV has to navigate each layer to reach the baby. After infecting the outer trophoblasts, the virus spreads cell by cell, like a slow-moving fire. Not every maternal infection leads to fetal infection. It's a race between the virus and the mother's immune system. CMV can trigger inflammation in the placenta, sometimes creating tiny breaks that make it easier for the virus to pass through. Ironically, the body's own defense can help the virus. CMV can also infect placental macrophages, immune cells meant to destroy invaders. Instead, these cells become Trojan horses, carrying the virus deeper and even across to the fetal side. Whether the virus reaches the fetus depends on how quickly the mother's immune system responds. A strong, fast response can contain the infection. If not, the virus breaks through. That's why the mother's immune status, new infection, or reactivation matters so much. Let's talk about when the risk is greatest. Timing is everything with congenital CMV. The first trimester is the most dangerous. This is when the baby's organs are forming and the placenta is still developing. A primary CMV infection during this time carries a 30–40% risk of transmission, and the consequences can be severe. The virus can disrupt organ and brain development, leading to lifelong complications. Later in pregnancy, the risk of transmission is higher, but the risk of severe damage is lower. Organs are already formed and just maturing. Most late infections don't cause major birth defects. If the mother has a recurrent infection, her immune system usually keeps the virus in check, making transmission rare and severe outcomes unlikely. That's why it's crucial to know if an infection is new or a reactivation. Next, let's see what happens if CMV does reach the baby. The impact can be life-changing. If CMV infects the fetus, the effects can range from invisible to life-altering. About 10% of babies with congenital CMV show symptoms at birth: low birth weight, small head size, rash, enlarged liver or spleen, and jaundice. But the most lasting damage is often to the brain and senses. Hearing loss is the most common long-term problem. Some babies are born deaf, Others lose hearing over time. Vision problems can also occur if the retina is damaged. Neurological issues like microcephaly, seizures, and developmental delays are possible. Many babies, up to 90%, look healthy at birth, but some will develop problems like hearing loss later. That's why early screening and regular hearing checks are so important. Identifying affected babies early allows for interventions, like hearing aids or cochlear implants, that can make a huge difference. The impact on families can be profound, but early action helps. Now let's talk about how to protect yourself and your baby. Prevention is key. With no CMV vaccine yet, prevention is all about reducing exposure, especially for pregnant women. Toddlers are a major source of CMV, so women working with young children need to be extra careful. The virus spreads through saliva and urine, so hygiene is your best defense. Wash hands often, especially after changing diapers or handling toys. Don't share food, drinks, or utensils with young children, and avoid kissing them on the mouth or cheek. These small changes can make a big difference. If you develop symptoms, your doctor can test for CMV antibodies to see if it's a new infection. If a primary infection is found, further testing, like amniocentesis, can check if the baby is affected. Newborns can be tested within the first 3 weeks of life for early diagnosis. Some states now screen all newborns for CMV, helping catch problems early. Early detection means better outcomes. We've covered a lot, from the placenta's defenses to CMV's sneaky tactics. The key takeaway: understanding CMV empowers you to protect your family. This isn't a rare disease, it's common, and awareness is your best tool. The placental barrier is strong but not invincible. Timing of infection matters most. The consequences, especially hearing loss and developmental delays, can be lifelong. That's why CMV should be part of every prenatal conversation. Talk to your doctor, ask questions, and practice good hygiene. Don't share cups, avoid saliva contact, and wash your hands. Advocate for more awareness and newborn screening in your community. The more we talk about CMV, the closer we get to a vaccine and better prevention. Preparing for a baby means creating the safest environment inside and out. Share this knowledge with others and help bring CMV out of the shadows. Thanks for watching. Stay informed and stay healthy.